Hi, welcome everyone. We'll give folks just another minute to get logged in and we'll get started on today's info session. Great. Well, again, welcome to today's online information session for the Rauschenberg Medical Emergency Grants. We are recording this and we'll be able to post this so that it'll be available on demand on our website. I'll go ahead and get us going. I am Molly Quinlan Hayes. I'm a program officer in the NIFA Grants Department and manage both of the Rauschenberg programs, the Rauschenberg Dancer Emergency Grants, for which we have a session on July 14th, and these Rauschenberg Medical Emergency Grants. And I'm joined by two of my colleagues. Sarah?
Hi, my name is Sarah O'Connell. I'm the director of NIFA Grants, and I'll mostly be on the back end here. I'll keep an eye on the Q&A, and I'll also do a brief intro to NIFA. But before I do that, I'll pass it over to Reina.
Hi everyone, my name is Reina Pahade. I use they, them pronouns. I'm the programs associate at NIFA Grants. I work really closely with Molly on helping to administer the medical and dancer emergency grants. And then I also work as a support person across all the programs that we offer in the grants department. And then today I'll also be on the back end. I'll be sending some helpful links throughout the chat.
Great, thank you. And as Sarah mentioned, today we'll be using the Q&A function. So at any point during the presentation, feel free to drop any questions there. And if we don't answer them during the presentation, we'll have plenty of time to catch up on those at the end. So a quick agenda for today will be Sarah will be doing a brief introduction to NIFA in general and our various programs. We'll talk about both accessibility and privacy considerations as they relate to the medical emergency grants. Then we'll go through an overview of the program. We'll review all of the eligibility and guidelines criteria. We'll actually walk through the application process and the online submittable application form. And then we want to share with you the review process. What happens after you submit your application, how the decisions get made. And then again, we'll have time for Q&A. But first of all, I'll toss it over to Sarah to talk about NIFA in general.
Thank you, Molly. So yes, in case this is any of your first intros to NIFA, I just wanted to give you a little bit of idea of the different programs that we have here. So first we have our awards and grants department where we distribute over 5.5 million through 15 different grant and award programs each year, the Rauschenberg Medical Emergency Grant being one of those grants. So we offer emergency grants like this one, but we also offer unrestricted and project-based grants, both to artists and small nonprofit organizations based in New York City, New York State, and as well as some that are nationwide, like this program. Next, we have our fiscal sponsorship department, and NIFA offers fiscal sponsorship as a fundraising tool for artists, projects, as well as emerging arts organizations that allows them to apply for funding using NIFA's 501c3 tax exempt status. This opens up opportunities and grants that you wouldn't otherwise be able to apply to without fiscal sponsorship. And that's something that we have applications that open on a quarterly basis if you're interested in looking into that. We also have our learning department, which is mostly a large range of professional development opportunities. And these are both for artists as well as arts administrators. We have some programs such as our career advice and training. We have lots of online workshops. We have a coaching program, and we also have leadership initiative programs. And then lastly, I'll talk about our online resources, which are mainly kind of two areas. One of those is our NIFA Classifieds, which shares jobs in the arts, artist opportunities, as well as studio and space rentals for artists. We also have a more recent addition to the classifieds, which is our volunteer portal. This is more for nonprofit organizations to offer free volunteer opportunities. And then the second area of our online resources are our emergency resources, which is a centralized list of emergency resources for artists across the US. So this highlights opportunities that are beyond what we offer at NYFA. And Molly, who's giving the presentation today, oversees that part of our website, and we often update it. So I definitely recommend checking that out to see if you qualify for any of those. And I think Raina has been adding links to all of these different departments in the chat. So please take a look after this presentation. And for now, I will pass it back over to Molly.
Right. Thank you, Sarah. As I mentioned, we take both accessibility and privacy seriously in all of our programs, and most particularly here. We are committed to supporting artists and arts workers at all stages of their creative careers. And we strongly encourage artists of color, LGBTQ plus artists, artists with disabilities, and artists from outside of New York to apply. This is one of our national programs, so artists residing anywhere in the US are eligible to apply to the emergency grants programs. And because we know that applicants are sharing a lot of quite personal information in these applications, there's an extra layer of confidentiality that we provide. One is that all of our panelists sign a confidentiality agreement. But we also mask personally identifying information from the panelists. So while they see all of your responses to the questions in the application, they don't have access to names, locations, or your medical documentation that you provide. And lastly, unlike some of our project grants and fellowships, we do not publicize the recipients of the awards in either the dancer or medical emergency grants. If recipients want to spread the word that they were awarded a grant, that is fine and up to them. Testimonials and word of mouth are one of the best ways that people hear about these programs, but we do not share those names from NYFA's side. So a quick just understanding of why this program it's really an ongoing part of Robert Rauschenberg's legacy to assist generative artists, so those who are creating their own independent work and who have been regularly showing their work publicly, to continue to return to their creative practice, to retain or regain their health, and to avoid overwhelming debt. So this program, which has been in place since 2020, is actually kind of a revisioning of a program called Change Inc. that he founded in his lifetime, again, to support artists who might otherwise forgo treatment or lose time, taking time away from their practice for their personal health. So we're very proud to be continuing that legacy. In this grants program, we provide grants of up to $5,000 for recent unexpected medical, dental, and mental health emergencies. And these are made available to artists in financial need who, again, are creating work in one of the eligible categories: visual arts, digital and electronic arts, video and film, and choreography. And those disciplines are selected by the foundation because those are the disciplines in which Robert Rauschenberg worked during his lifetime and career. So grants are up to $5,000. We run 6 bi-monthly cycles per year, and we announce the dates of those 3 at a time. So we're always moving forward 2 months in time. So we're taping this in July of 2026, and we'll talk about cycles 37, 38, and 39. But for those who are in need in the future, we will continue to post on our website the cycles of future rounds that will be happening every other month. We have the funds to provide approximately 30 to 35 grants per cycle. We have a fixed amount, and it really just depends on the amount that people are requesting. And although we hope they don't need to, we do allow past recipients in need to reapply after 5 years since their initial award. When looking at whether you're eligible, there are three different lenses through which to look, and we'll go through each one of these: individual, artistic, and the nature of your emergency. So to be eligible as just an individual person, you do need to be a generative artist working in one of the four eligible disciplines. You do need to be 21 years or older on the cycle's application deadline. And you must reside in the US, or that's including the DC area, a tribal nation, or a US territory. We define artist in need in a financial capacity of having a gross income of $80,000 a year or lower, and that's averaged over your last two federal tax returns. If you file jointly, then that is double to $160,000 total averaged. Again, you must not have received an emergency grant through NYFA in the last 5 years, and you cannot be enrolled in a degree-seeking program at the time that you apply. The second lens of artistic eligibility, again, means that you are making work in one or more of the four categories. You must be the primary maker of the creative work, the individual with final creative control. So, for example, in video and film, that means that you are either the director and or the producer. And you must be able to demonstrate through your resume that you've been showing your work, that you have sustained activity and public-facing activity over the course of at least the last 5 years. So whatever of these disciplines you work in, you need to have had at least one public showing, a performance, a screening, even a work in progress, but shown publicly once a year over the last 5 years. So again, this just kind of repeats what I just said. These need to be some sort of opportunity for the public to experience your work in an in-person way. So again, live screenings, exhibits, showings. It can be a residency if there's some sort of public interactive activity. It could be a community engagement project, but it does need to feature your own artwork. And again, these are the types of eligible events. It can be in any kind of public space, paid or free. It could be public art or murals or community-based projects. Again, residencies if there's a public-facing component. And if you do have had work acquired, either public art or by a museum or other public collection, on your resume, you should list that the year that the piece was installed or acquired. So that counts for 1 year of activity. Events that we don't consider eligible meeting these requirements would be any exhibits, performance, or activities that are done while you are a student. Publications, papers, and interviews are not encompassed, whether those are in print or online. And we do, this is to support the work of those creating independent individual work. So things that are produced for commercial or mass production or are work for hire are not eligible. And those include things like TV shows, webcasts and podcasts, design, commissions, and industrial films and commercials. Lectures and workshops typically don't count unless there is an opportunity to view your actual work. So your literal work needs to be there for the public to see. We do recognize that life happens, and so we do accommodate up to a year of inactivity. So within the last 5 years since 2021, whether for personal, professional, family, medical reasons, whatever, if you were inactive for up to a year, that is fine. We can only consider work created for online distribution and consumption if it's a creative work that meets the description on the previous slide, and it was actively marketed to the public for showing at a specific date and time. So an example of this would be if you have a film and it is part of an online film festival and it is screening at a particular time in the lineup and that is promoted, that is eligible. If you have work that is up on your own website or on Instagram or on an online art collection, but it's only available digitally and it's just there 24/7, that does not fall in the kind of public-facing activity that qualifies for this program. And also, differently than many arts grants, Portfolios and work samples are not required, and in fact, we don't request them and we don't accept them. Demonstrated need is the only thing that we look at in this program. We don't look at artistic merit or artistic quality or work samples, just your level of activity and your need. So the final lens of what is an eligible emergency in this program. This is a one-time, unexpected, and non-chronic condition. So it can't be something that you've planned for. And it's something that without treatment, it's going to have or has had an extreme impact on your daily life and your ability to carry out your practice. It has to have occurred within approximately the last 6 months. So for cycle 37, which is open as we record this, that's December 1st of 2025 or after. It needs to be the date that the emergency, either the accident or injury happened, or the date you sought medical treatment or care. And then one thing that has changed, if you have been to these info sessions in the past, all of the treatment that the funds are requested for needs to happen in the US. However, we do recognize that artists travel, you do residencies, you do research out of the country. And so if you do experience a medical emergency out of the country, but you return to get treatment, as long as that's within 2 weeks and the treatment happens in the US, that is a situation where you can request a Rauschenberg Emergency Medical Grant. What can you request money for? These are related and eligible expenses for up to 12 months from the date of the emergency. So for instance, if you fell and broke your arm on February 1st, and you needed diagnosis, x-rays, surgery, and then physical therapy, and that lasted for some time, that could all fall within the eligible treatment period. It can be things that you have already incurred and paid for, so you would be paying yourself back, or things that you haven't yet incurred, but you will. And so this can be for you to be able to seek treatment, maybe if you've been putting it off because you don't have the funds. This allows you in comfort, if you are awarded a grant, to go ahead and schedule treatment. You can have paid for part of it or all of it, not paid for any of it. All of that is fine. But these are, again, just for your own out-of-pocket expenses. So whether or not you have insurance, these are your own expenses. And we'll go into exactly what those look like next. So these can be provider bills, including copays. So these are for doctors, therapists, dental care providers. This can also include tests and diagnostics or consultations. If you know that you need treatment, but you're not sure what treatment is best, the funds can be used to go in and get a consultation and develop a treatment plan with your provider. It can include physical or occupational therapy, acupuncture, chiropractic care, drugs that are prescribed specifically for the emergency medical condition, emergency dental work, and transportation expenses to and from appointments and treatment, whether that is public transportation or you need to get care in another location. For instance, if you live in a rural area and you need to see a specialist in town, then your transportation to and from those appointments is an eligible expense. Things that are not eligible for funding in this program would be non-emergency medical conditions. Anything that is, if you have ongoing needs for medical, psychological, or psychiatric treatment, wellness visits, regular checkups, can't use the funds for those. Standard vision care, eyeglasses, hearing aids are also not eligible for these funds. Elective procedures, so anything where you choose to undergo a procedure, you pre-schedule it, can't fall within this program. Typically, medical equipment is not eligible unless, for instance, you fell and broke your wrist and you need, a cane for a short time while you recover. That would be eligible, but typically, big medical equipment isn't in this program's purview. You also can't use the funds for insurance, either purchasing it or for monthly premiums. And we don't support experimental treatments or treatments through herbal supplement or dietary needs. Another change, because we always try to be flexible as we learn from our applicants, we do get a number of applications from folks who do have either Medicaid or Medicare insurance. We know that these don't do a great job with dental care. And so a lot of times folks they put off dental care until it gets to be kind of critical. And that is when they come to this program for funding, and that's fine. However, we also know that you may have Medicare or Medicaid covering your direct expenses to the doctor, but while you're in care, it is still impacting your ability to carry out your practice and make a living. And so you may, if you're covered in one of these programs, apply for eligible essential living expenses for yourself only. This is a pilot. We've just started it in the last cycle. But you can demonstrate that you have Medicaid or Medicare, demonstrate your emergency. You'll need to document that. But then you can request the funds for those essential expenses while you're in treatment. So rent and utilities, food or food delivery, toiletries, personal grooming, transportation, those kinds of things. So generally within the spirit of the program. And again, all of those would need to be documented. So a little pause here. Now we're going to move into what the application process actually entailed and the forms that you will fill out. And all of our applications are taken online through Submittable, which is a pretty user-friendly platform. And we'll be asking for these 6 sets of information. There's an eligibility form, which asks just a basic series of questions. Please answer truthfully, because this is there to be a time and energy saver for you. If you are not eligible, it's best to know that off the bat and then look at our other emergency resources that Sarah mentioned, explore other avenues. We don't want you to take the time and energy to fill out an entire application and then at the end of it realize that you're not eligible. So use the eligibility form. If it does determine that you are eligible in this cycle, it'll immediately direct you to the application where you will submit your contact information, some information about yourself, medical emergency information, verification. You'll be asked to upload whatever material you have regarding your condition. And then we'll ask you for some applicant demographics. That information doesn't go to the panel. It's just for us to know who we are serving. We'll also ask you to attach a PDF, which is your resume or bio or CV. This can be as formal or not as you have. We're not asking you to create something especially for us, but please make sure that it does include the following. If it doesn't, then that could put your application in jeopardy. You need to make sure that you are listing recent and sustained artistic activity since at least 2021. If your history goes back prior to that, that is fine. You need to make sure that it is demonstrating you have at least one public-facing activity for each year since 2021. Again, 1 year of inactivity is accepted. But make sure that your listings have this information. This is what might not be on a typical resume. We need to check your eligibility in this program. The year in which the activity took place, the location, so the city or town name, and then the venue, if it was a festival, if it was a performing arts center, if it was a theater, the title of the work or the event, and then your role. For instance, if it's a film screening, let us know that you were the director. If you are a choreographer and you perform your own work, please note that so that we can see that it wasn't just a performance, but that your work was also being performed. And just a reminder, if you perform in video, film, or television, that is not an eligible discipline. It's the maker of intrinsic work of film or video that counts, not just recording a performance on film. So this is just a quick snapshot of what you see on the application. We provide you with all the definitions, so you have them right in front of you. You will select what type of emergency, mental health, medical, or dental. And then, although we hate that this happens, sometimes people have concurrent emergencies. And if that does happen, you certainly can apply for funds for both. So it gives you the option to select a second emergency. You'll tell us the date of the medical emergency onset, and then the amount of your request, up to $5,000. We recommend that you request the maximum because there's no changing it afterwards. If you ask for 3,000 and you're awarded a grant, and then later you find out your expenses are 5,000, we have already allocated all of the funds. And you can't apply again for 5 years. So we recommend that you request the maximum. And then if your expenses don't reach that, that's fine. We'll reimburse you for the 4,000 it actually cost you, and we'll take that extra $1,000 and we'll roll it into the next cycle for another artist. A quick, very brief summarize the onset and nature of the emergency, just one or two sentences. I was riding my bike through Central Park and I fell down and I broke my wrist. Then you'll also be asked for what specific expenses you're requesting. This is for us to make sure that you are requesting eligible expenses. And then there are these 3 narrative questions of up to 150 words each. Describe the impact of the emergency on your creative practice. Describe the severity of your condition, and describe the economic severity. These are the 3 questions that the panelists, our review panelists, use to score your application. So you do not need to be a professional grant writer to be successful, but take the time to really tell your story, your unique story in these answers, so that the panelists who are reviewing lots of applications can get a sense of your particular situation. You don't need to use all 150 words. Bullets or short statements are fine, but don't be so brief that they can't really get a sense of what you're going through. Then you'll be asked to just tick off in this medical severity checklist all of these statements that are true for you. This is just background information for us to have. Same for this economic severity checklist. This information doesn't go to the panel. It's just for us to have a sense of what economic barriers exist in your life as part of your request. And then you'll be asked to upload your medical documentation. So the 2 attachments that you'll have will be your resume or bio and your medical documentation. We ask, please don't send us, x-rays or photos. We don't need to see the mechanics of your emergency. What we do need to see is a record of diagnosis or injury from your medical provider, and what treatment you've gotten or is going to be required, with dates and the type of treatment and what it's going to cost you or has cost you. Send what you have. If this has been something very recent and you're applying now and you don't have material, that is fine. Go ahead and submit your application. We can collect it afterwards. If you have just left the ER and that's all you have and you don't know what kind of treatment you have or what it's going to cost, that is fine as well. Upload what you have, ask for the maximum amount, and we'll go from there. However, if you've already begun your treatment, if you have copies of the diagnosis and the receipts that you've paid, please upload those. It gives us a clearer sense of your situation from the staff point of view. And also, if you are to receive an award, this allows us to process your award that much more quickly if we have the documents on hand. Again, if you don't have a diagnosis or treatment, upload, it can just be one typed page, but tell us what you can. If you're able to research providers in your area or what costs are, sometimes it's easy to say, oh, I found out that a dental crown in my area is probably going to cost between $2,500 and $3,500. Again, request the maximum likely amount. And if you have been putting off treatment because you can't afford it, and you are awarded a grant, we are happy to work with artists to be able to get you a portion of the funding to allow you to immediately get to a provider, get an initial consultation and diagnosis, and figure out what you need. So the whole idea is to get you to treatment as quickly as possible. A couple of other just guidelines to know as you're working through the process. Submittable allows you to work in stages. You can save your draft and go back to it. If you do require an accommodation, such as a paper application or assistance completing your online application, that is fine too. Just let us know as quickly as possible. through our email, emergencyfunds@nifa.org, or we've listed here our phone number, and extension 239 is the emergency funds office. And we'll be happy to work with you to get find a way for you to submit your application. We also accept applications by proxy. So if a friend or colleague is ill or injured and isn't able to physically fill out the application themselves, with their permission, a proxy, a family member, a friend, a colleague, a staff person is welcome to submit an application on their behalf. Please note that demand for emergency funding is high. We have generous funding from the Robert Rauschenberg Foundation, but we always receive more eligible requests than we're able to fund in any given cycle. So an application is not a guarantee of support. Also, we look at everything, everything goes to the panel at the same time. So applying early does not give you an advantage. We don't want you to wait until the very last second to apply, but take the time to look at the questions. We give you some kind of guidance on what your response should include. Take the time to really, again, tell your story, to craft those answers in a way that they're not just one-off and sloppy. We want you to have the best shot at funding as possible. So what happens after you submit the application online, which you will do before 5 p.m. Eastern on the deadline? First of all, staff checks it. We make sure that it's complete and that indeed you meet all of the eligibility requirements. Those that are eligible go to our peer panel. So we have peers, other artists and arts administrators from across the country working in all of the disciplines represented in this program. They sign a confidentiality agreement and they review the applications online. Again, not seeing any of your personal information. So they numerically score your application based on those three questions: the medical severity, the economic severity, and the impact on your practice. So we get all of the scores back and we take the top tier of scores. There's usually a clear breaking point. So those go into a lottery. So if you are in that top pool, it is randomized and we just let the universe pick. The high lottery number gets funded, and then we literally go down that lottery list until we've spent all the funds for that cycle. And that's a very intentional process because if you get to the point, you've gone through the eligibility check, you've gone through the panel review, they've scored you highly, everyone in that pool, obviously can use and needs the funding, but we simply don't have enough in each cycle. So this, again, kind of lets the universe decide. And if you are eligible and not funded in a cycle, we will automatically roll you over for consideration in the next cycle. So you don't have to reapply again. So that is just, to us, the fairest way to distribute the funds. We turn these around just as quickly as we can while doing a responsible review process. But you will get notification if you are funded or not within 7 weeks of when you applied. And grant awards can be paid sometimes more quickly than this, but certainly if you get all of your paperwork in within 3 to 4 weeks of notification. So we get this funds out as quickly as we can. Again, we do not name publicly either applicants or grantees. And we do, as a courtesy, roll over non-funded applications for one cycle. And the panel does stagger over time. So each panel, there's a different mix of people reviewing your application. Reminder of our upcoming deadlines. We're currently in cycle 37. It will close on July 14th, promptly at 5 p.m. Eastern. Submittable cuts it off. So if you wait and have a technical problem at your end, we will not be able to accept your application. And we'll be notifying folks in cycle 37 in early September. Again, cycle 38 opens August 18th with the deadline of September 15th. And cycle 39 opens on October 20th with a deadline of November 17th. Just a reminder again, because this whole program moves forward 2 months in time, so does the eligible emergency date. So for cycle 37, it's able to fund emergencies that happen December 1 or later. In cycle 38, that's going to be February 1 or later. The cycle 39, that would be April 1 or later. So it always moves forward in time. And again, as each cycle moves forward, we will add another cycle's information to the website at nifa.org/RMEG. We also, as I mentioned, have a dancer emergency grant program. These are grants of up to $3,000 for professional dancers who've recently lost work. And these funds can be used for essential living expenses like rent, utilities, transportation, medical care. That opened today and will close on August 4th. And we also will have bi-monthly cycles of the dancer emergency grants. And we'll be holding an info session this time next Tuesday. And that concludes the formal part of our presentation. So I'm going to invite Sarah and Raina back to share any questions that came in the Q&A.
Thank you, Molly. That was great. We do have two questions that have come in so far, and anyone else who's out there, feel free to type yours in while we answer these. But the first one is performance art, does performance art fall into visual arts?
It does not. We define those as, and you can see them all on the website, but it is painting, sculpture, printmaking, book arts, craft. Um, those are
And
defined as visual art
photography.
and photography. Thank you.
Yes, I'm dropping just another, Raina already dropped it in earlier, but just dropping it in again, that it's a page that goes directly to the discipline definitions that we use across all of our programs. Okay, the next question is what separates a competitive application from one that is merely eligible?
That's a great question. And it's hard for me to say. We don't, unlike some other programs, we don't collect and offer panel comments. But I would say that the ones that I see that score highly, again, have answered each of the three questions completely and distinctly. Sometimes people will kind of use the same answer for each of the questions, and that doesn't, again, let the panel score you on each of the three criteria. So I would say looking at each of those three questions clearly and distinctly, and again, telling your specific story. Just giving a very generic answer, I'm not able to paint. That's not as informational as really what is your practice, what is your process, and why is this medical situation hindering that process? Those kinds of specifics are what the panel really needs to um, be able to score effectively.
Right. Okay, we actually just had one more come in. Let's see. Oops. It is saying, how do interdisciplinary artists that span public arts that include murals but also socially engaged practice, etc.?
Question. We know that people kind of span and cross disciplines, and that is fine. Um, Again, we're just looking for the demonstration of the requirements for this program. So if you do have murals that are your work primarily, you may have community interaction or community informed design, but as long as it's primarily your work, and that it is shown publicly, and that you have new work or different events every year between 2021 and now, those are the requirements. The other things are wonderful, and we do have people who might work in choreography and visual arts, but again, we're looking for that commitment to the discipline as shown by at least one public-facing activity annually. Sarah, is
Yeah,
there anything else that you would add to that?
well, and I would just say since choreography and visual arts are both eligible, like you could include both, if you do both, you could include both works and that would count for your one event annually. But if you also are, for example, a playwright, which is not eligible for this grant, that's totally acceptable and fine and exciting that you're making work as a playwright as well, but it won't count towards your eligibility. It won't hurt you either, but you will have to have one of the at least one event per year in the eligible disciplines, which I think is the distinction. Okay, that is it right now. We can give it just another minute, and I guess I'll just say that, what's listed up on the slide right now is great to know. This NYFA.org/RMEG is the main webpage that will have all of this information, and then to contact us at emergencyfunds@NYFA.org if you have any questions. Yeah.
Great. Thank you. I will make one more plug for just following the deadline. Again, it's heartbreaking when someone has a technical issue on their end and didn't get the application in at 5 because when submittable cuts it off, it cuts it off. So please do that. And again, best to ask us any questions or even ask us to, if you have questions about the resume or what should be on it, please let us know before you submit it. We are very available and we would much rather work with you before you submit it and make sure it's eligible than receive something that's not eligible. Great. Well, we will have this recording up on the website within the next couple of days. And again, we're always here to answer any questions that you might have after today. Please spread the word. Again, we know that word of mouth, people hear about this from friends and colleagues when they have an accident or an injury or a need. And so we appreciate you being ambassadors for the program as well. And we look forward to working with you.
Thank you.
Take care, everyone.